Now, there's been a dramatic drop in the number of heroin addicts. A report by the NHS agency set up to tackle the scourge of drugs revealed that the number of heroin addicts has dropped to its lowest ever level. And people being treated for drug addiction in England are recovering in record numbers. The National Treatment Agency for Substance Misuse says that since 2005, the number of new heroin addicts admitted for treatment has fallen from 47,700 6 years ago to just over 9,000 last year. Cannabis remains the most widely used drug, accounting for 77% of all recent drug use. But even use of that has declined from 11% in 2001 to 7% in 2010. Drug treatment has also improved, with nearly 30,000 successfully completing rehabilitation last year, up from nearly 28,000 the previous year, and 3 times the number in 2005. There is some concern, though, of a growing problem with users who have a long-term addiction seeking treatment in their 40s. More than 16,000 people over 40 started a new course of treatment last year, compared with just over 12,500 in 2005. Well, joining us now in the studio is Rosanna O'Connor, Director of Delivery at the National Treatment Agency for Substance Misuse, and Dr. Adam Winstock, an addiction psychiatrist at the Maudsley Hospital. Rosanna O'Connor, starting with you first. These heroin figures are really quite staggering. What's behind it?
Well, it's very encouraging. Fewer people are using heroin. Fewer people are using heroin and crack. Fewer people are having problems with heroin and crack.
But why?
Well, because fewer people are coming into treatment for heroin and crack, which shows that there's a reducing problem. Far more people are able to recover from drugs these days. And I think the most significant thing in the numbers is that the numbers of young people using the most problematic drugs, particularly heroin, has dramatically reduced.
But is it a supply issue, or are people turning to other drugs?
I think it's not quite clear, but I think the best guess is that young people have seen the awful havoc that heroin use brings to individuals and communities, and are saying, no, thank you, I don't want any of that.
But Dr. Adam Winstock, are we missing the point here, though, talking about heroin and so on, that in fact should we be worrying more about new party drugs? I've had thousands of tweets today talking about the fact that, yes, people aren't doing heroin in such numbers, but they are doing things like ketamine, for example.
I think new drugs are certainly an issue, but I still think alcohol remains the biggest untreated drug problem in the UK today, and it's certainly the most affordable, the most widely available, and you can be comfortably alcohol dependent in the UK today for about £5. But I accept drugs like ketamine, GHB, methadone. Those are drugs that are being used increasingly commonly and are starting to cause real problems for some people.
A lot of people might be steering clear of heroin and trying ketamine instead, in the belief that it's less harmful because it's a Class C drug. What are the risks?
Ketamine is safe within a medical environment. The real risks with ketamine for people using outside that environment are immobility and vulnerability, which makes you really prone to assault and accidents. And increasingly, we know that ketamine can cause real harms with your bladder. So people who are peeing blood, having frequency, pain when they pass water, really need to go and see their GP and be referred to a kidney specialist.
But how do you treat these new party drugs? What does your agency do about that?
Well, our expectation of all local areas is that they are able to respond to whatever the presenting need is in that locality. We'd expect people to understand those changing patterns in drug use, and if there are the sort of problems coming to the fore, as Adam has described, that they would be able to respond to them. And I think increasingly, as drug services are seeing fewer heroin users, they have the capacity, as long as the investment is retained, to be able to respond to new and emerging needs.
Dr. Adam Winstock, do you think the policy is responsive enough to these new drugs?
I think that we can always do more. I think there needs to be an emphasis on raising individuals' awareness of the way drugs are affecting them. And I think most importantly, people using these drugs aren't going to be presenting to traditional drug services. They're going to be presenting to primary care, mental health, emergency departments, urology services, and there needs to be an integrated pathway into services. And most importantly, people need to feel able to talk around their drug use in a way that they don't feel stigmatised and judged.
Adam Winstock, Rosanna O'Connor, thank you very much for joining us.